If there's one message I want to send across today, is that people with borderline personality disorder can get well. Uh, it can take time, depending upon the circumstances. Most of the research shows that about two-thirds of the patients can get well to various extents in about 1 to 2 years' time. Of course, the treatments are psychological in nature. It's the talk therapy. That's what is found to be helpful. Uh, just having a chat with a psychologist or just getting some counseling is unlikely to help. We are looking at specialized psychological treatments which are generally focused around a few things. One of them is helping the person to understand why they have developed these difficulties, why they are in so much of pain, and why they tend to, for example, harm themselves, why they have these urges to, kill themselves, for example, or why they do certain things impulsively, or why they have difficulty in relationships. All of those things can be very confusing if you don't know why it has happened, why one has developed a certain way of thinking, certain way of feeling, or certain way of behaving. Unfortunately, sometimes people blame themselves for it. So getting a good understanding of why can go a long way in healing the person. Second thing is, once we know why, also we need to learn, are there some ways we can change it? So can we develop some new skills? Can we develop some skills to manage our emotions, or manage the painful thoughts, or try and develop some skills to prevent the urges to act on certain things which can be unhelpful and learned in the context of psychological treatment. And those treatments are quite effective. We know that it works, and people do get well, and people get well all the time. And you need about 1 to 2 years of intensive psychological work. So after that, the person is equipped to continue the recovery journey and the healing journey, on their own, or with some support. In a very small number of situations, people might need a longer term psychological treatments. Sometimes it can range up from 2 to 5 years. That's in a small number of people. For most people, 1 to 2 years of time, I think they can get back on the tracks.